13,000 a week or two ago. So we'd like to see people coming forward, any symptoms at all. Anything that you think might be a cough or a cold that has any sort of symptoms of an upper respiratory nature, please come forward. Runny nose, cough, whatever it might be, just come forward and get tested. In New South Wales, we've had total tests now of 355,738 just in the last few months. So I want to thank the community for that, because they do need, all of us need to be tested if we have any symptoms whatsoever. Of the total number of cases of 3,074, 2,611 have recovered. And that's a very positive message for the community that by far the majority of people have very mild symptoms, but even if you do have more severe symptoms, the odds are you will recover. So we are doing very well. In fact, I met a gentleman this morning when I was buying my coffee who had been in Royal North Shore Hospital and was telling us just how incredible the nurses and doctors were at Royal North Shore Hospital looking after him. There are currently 101 COVID-19 cases being treated by New South Wales Health. And of those, there are 6 people in the intensive care units and 3 are on ventilators. More generally, I'm pleased that the community, after all the sacrifices that they've made in the last few months, are now getting out and about and enjoying our new freedoms. But the sacrifices that people have made, I think, do need to be certainly at the forefront of our mind as we consider the way we're moving about. Certainly from what I've seen, there are a lot more people out, but there are also a lot of people who are not actually adhering to the social distancing message. I know even in my local area this morning, I saw a group of bike riders obviously getting their Saturday morning exercise, but then sitting quite close together in their coffee shop, or actually outside the coffee shop, but still very, very close together. We need to remember that this virus is still amongst us. This virus is still extremely dangerous. We need vigilance, and we need to make sure the sacrifice that we've all endured in the last few months sees positive outcomes going forward. The new normal is to enjoy the new freedoms, but enjoy them in a sensible way. Enjoy them in a way that reflects all the messages that Dr. McAnulty, Dr. Chant have been telling us. And those messages are, obviously, adhere to social distancing, wherever you are. We've seen when one major retailer opened last week, people literally piling up at the front. That's not COVID safe, that's COVID dangerous. We've seen people today who are out and about enjoying their freedoms, but unfortunately, some of them are also being COVID dangerous. We need to recognise that those freedoms and sacrifice will be worth it if we can just keep the transmission down. Transmission will be stopped, or at least reduced dramatically, if we simply stick to the basic message of social distance. Social distance at all times. You know, basically treat yourself and others as if they have COVID-19. If you do that, we will all be safe, and our freedoms, of course, will grow. We will have more freedoms. But unfortunately, unless there's a vaccine or a good treatment or an effective fast treatment, we know that this very dangerous virus is still quite capable of moving amongst us and effectively doing its evil best. I want to also just acknowledge that the AMA has sent a very clear message out, the Australian Medical Association and the Australian Dental Association, that there are a lot of people during this particular period in the last few months who have simply shut down their own medical attention. That's a real problem, because people who have medical issues, but even if you don't know you have a medical issue, you should still be going to your GP, you should still be going to your dentist. The AMA has reported that 85% of GPs are seeing far less patients. In fact, some report that they're seeing a third to a half of their normal patient load. What that tells us is that a lot of folks are actually not going out and looking after themselves. The message here from me as the Health Minister is you still need to look after yourself. Please go and see your GP. Please get back to the dentist that you would normally go to. Dentists weren't, of course, stopped, but practically they did make decisions because there was obviously issues that they needed to work through in terms of PPE, personal protective equipment and so on. But that's now not an issue. The PPE is available, dentists are out, doctors are available. So please just get back to doing what you would normally do to look after yourselves. I'm going to ask Dr. Jeremy McAnulty to make some comments, and then I'll ask Assistant Police Commissioner Hazzard to also make some comments from the police's perspective. Dr. McAnulty.
Thank you, Minister. We've had 3 new cases diagnosed in the 24 hours to 8 o'clock last night. Those 3 cases were in an overseas traveller who's in a quarantine hotel, in a person who was close contact of a known case in the eastern suburbs area, and 1 case under investigation in Western Sydney. So while there are 3 cases, which is a small number, we do know that the virus is bubbling underneath the surface, and that a really important message is that people get tested if they have any symptoms at all. You can do that easily through your COVID clinic, at your local hospital, through your GP, through private pathology, or in emergency departments. We know the virus is still swirling around the world, so it's a major threat and continues to cause havoc in many countries. We've been really lucky in Australia, in New South Wales, that we've been able to suppress it, but to continue suppressing it, we need to follow those public health advice, social distancing, high rates of testing. We've got high rates of testing in New South Wales, but we want to keep them high and even higher so that people with even the mildest of symptoms come forward for testing. We've seen in the last week or so some cases in the Penrith LGA without identified contacts. So we're really particularly urging people in the Penrith LGA to come forward for testing at one of the many venues that you can go to.